We are going to start parallel session number 7 called Systemic Risk, Inequality and Inclusion Lessons from the Pandemic for Disaster Risk Reduction. This is a session organized by the Regional Advisory Group for Science and Technology, the Pan American Health Organization, the Center of Coordination for Disaster Prevention of Central America and Dominican Republic, the World Network of Civil Society Organizations for Disaster Risk Reduction, the Caribbean Agency for Disaster Emergency Management, and the Group of Youth for Disaster Risk Reduction. This is going to be moderated by Jeremy Collymore, and we welcome him. He's an honorary research fellow of the West Indies, a geographer with a background in design and environmental planning and more than 40 years experience in policies, practices, and disaster risk management operations. Jeremy, the floor is yours.
Thank you and good morning all. Welcome to this parallel session 7, Systemic Risk, Inequality, Inclusion from the Pandemic Lens, Lessons for DRR. The purpose of this session is to explore through the lens of a diverse stakeholders how recent events, including COVID-19 and the Ukraine war, are helping us to appreciate the implications of systemic risk thinking for disaster risk management planning and inform our policy and practice. The objective of the session is to get stakeholders' perspectives on the interface of governance and other considerations in a systemic risk approach to DRM. And secondly, to identify ways for strengthening communication about the understanding and acting in the management of a multi-risk environment. To help us explore this conversation of experience, we have with us Leandro Folgar, the president of CIBAL, Uruguay's Educational Technology and Innovation Agency, Claudia Herrera, the executive secretary of the Coordination Center for Disaster Prevention in Central America and the Dominican Republic, CEPREDINAC, and I understand she's the first woman to hold that position since its inception. Congratulations. We also have Natalia Gomez, an environmental engineer, member of the NDRR ROC Youth Committee, and an advisor to the Global Youth Panel Center for Adaptation. We have Giovanna Osorio, a psychologist specialized in the area of disability and inclusiveness. And finally, we have Alex Camacho, the regional advisor on emergency preparedness and disaster risk reduction for the Pan American Health Organization, and an expert in disability and inclusion in disaster risk management. So you see, we do have a very diverse panel that reflects the interest and the focus of the scope of this conversation. Now, to you here and online, there will be an opportunity for you to participate through asking questions on Slido, as will come up on the screen. And those of you who are virtual, you can link and to hop in on the right and select the Slido TO app. I would like to set the context for this conversation, which I think it would be, by making a few remarks. First of all, I want to suggest that at no point in human history have we faced such an array of both familiar and unfamiliar risks interacting in a hyper-connected, rapidly changing world. This includes those associated with climate change and the intensity and frequency of the related hazards. These risks are systemic and require concerted and urgent effort to reduce them in ways that are integrated and innovative, as suggested by the UN GARP 2019 report. In Latin America and the Caribbean, we continue to experience the consequences of the COVID-19 pandemic and the war in Ukraine, which are impacting all dimensions of our society and economy, accelerating the inequalities in our communities, and generally setting back development gains. Several of the states in Latin America and the Caribbean have also had to deal with volcanic eruptions and earthquakes. In St. Vincent and the Grenadines, it says in the Caribbean, with a population of 104,000 and a land area of 389 kilometers squared, had to deal with a volcanic eruption, COVID-19, a dengue outbreak, and a tropical storm all within that same period. In this context, you would agree with me that a hazard by hazard approach to risk management is no longer useful. COVID-19, I would argue, have reaffirmed how interconnected our world is, both in terms of how quickly issues arising internationally can affect us at the regional, national, and local levels, and how problems in one sector can have severe and damaging consequences in another. What began as a health crisis triggered cascading impacts ranging to sectors from education to transport, manufacturing, and in the Caribbean, tourism. And this is supported by the work of the UN ECLAC 2021. So the key message of this session is that risk mitigation is essential to sustainable development. And if we admit that the broad dimensions of resilience are interconnected, then the central value of systemic thinking is to facilitate risk management solutions which are internally and externally integrated and coherent. Our government's interventions in response to the COVID crisis expanded the ideas and the possibilities of public policy for coping with systemic risk. Action in systemic risk is a key pathway to resilient development and provides a bridge for the operationalization of the global frameworks, such as Sendai, within local, national, and resilient spaces. It requires that we accelerate investment in the understanding of physical dynamics of the hazards we face, the geospatial and socioeconomic demographic context in which they are realized, and use such information in decision making at all levels. We must move from systemic risk as a concept and link it to outputs that inform our early warning systems, the foresighting and futurist thinking, alignment of efforts, and the necessary long-term commitments to resilient and sustainable development. In other words, systemic risk is not an idea, it's a medium for engagement in the development space. And so now, to take this conversation forward, I would like to pose a question, my first question to the panel, and it is this. COVID-19 and the war in Ukraine have had cascading impacts on our societies and economies. What lessons have you learned? And I'll begin first with Leandro.
Thank you for the introduction, and thank you all for being here. I'm actually going to continue in Spanish, if it's better. Desde 2020,
Since 2020, I took on the presidency of CEIBAL, which is the innovation agency with technologies for the educational system. We believe that the possibility of deploying technology-based systems to keep our students connected was key, but we would never have suspected that COVID would arise. And one of the key lessons we learned was that even though we had good penetration in educational centers, when a disaster happens, like the COVID pandemic, students were not ready.
Ya no podía ser más pensada en clave de escuela u hogar, sino del individuo. Nos tuvimos que empezar a preocupar de cómo llevar conectividad y dispositivos al individuo en cualquier situación y cómo crear sistemas redundantes que permitieran que eso pudiera ser posible a pesar de cortes de electricidad o cortes de servicios principales.
Thank you very much, Leandro. So from what you were saying, COVID-19 created an opportunity to move a policy space that you're already thinking of? Okay, now we'll hear from Claudia.
Thank you. Hola, muchas gracias por compartir, permitirnos compartir esta vivencia también.
Thank you for having us. From the intergovernmental perspective, it's nice to share in terms of the Latin America integration to this cross-cutting approach. In Central America, as you know, we have an infrastructure contributing to a regional network from the environmental and social perspectives, and each of the entities and pillars promotes the fulfillment of those strategies. But this challenging situation marked that our heads of state developed a special plan to tackle the pandemic, and also for risk management in order to understand the dimensions of the impact in the social perspective. So we developed the COVID contingency plan with the support of the health ministries and with the support of the OPS, WHO, and we continued articulating all the efforts at a regional level. And as mentioned before, there's a regional agency which requires homologation of strategies, tools, and instruments in this always changing environmental situation. We've also developed certain strategies to link the dimension of impact from a social perspective. Now, in the regional platform, we have the secretary of the system to evidence the specific impact which the population is suffering and how to minimize the impact in the territory. Also, we try to establish how the special impact had to do with technologies, and also we cannot ignore the impact in the civil protection situation because the emergency has been persistent since 2020, as well as the cyclones season, and also the occurrence of all kinds of meteorological and climate events having a negative impact in our GDP, representing 8 years of going back into our economies, as well as several other negative impacts affecting our region. So we have to keep on approaching risks from a systemic approach, and we need to keep preparing for emergencies and identifying key elements for resilience and building.
Thank you very much for that. When you get the chance, when you come back, I really want you to explore a little further about the governance arrangements operating in that multi-hazard changing space. So now we'll go on to Alex Camacho from PAHO.
Gracias, Jeremy. En primer lugar,
Thank you, Jeremy. I would like to highlight a couple of points previously mentioned by the other panelists and in other sessions as well. We know that COVID-19 had a direct and indirect impact on all sectors, and that is one of the elements and messages, as mentioned by Claudia before, on the importance of addressing the risk as a systemic risk. And this affected all the health systems of every country. All countries have suffered the load of the COVID-19 pandemic and also the health systems. So one of my main points has to do with the seventh goal of the Sendai framework, which is the number of health systems that have been impacted and affected because of the COVID-19 pandemic. If we look at the quantity and quality of information we have up to date, now that almost 3 years have gone by since this set off of the pandemic, that is very limited. So we have to enhance the collection of data in order to base our decisions on data itself and evidence. So disruption of health services was due to the direct effects of pandemic, but also to other related aspects with the discontinuation of those diseases or treatments which had to be discontinued due to the pandemic emergency. But there were other factors like the price of resources and also the lack of appropriate transportation facilities and services for the rest of the resources. And also, we have to highlight the human factor of all the professionals who were in charge of the management of the health services. The continuity of business and the best business a society has, which is ensuring access to health services, and also the disproportionate impact on certain groups like people with disability and indigenous populations. So we have to ensure access to health services on an accessible way and also considering all cultural differences of each case.
Now we want to go to Giovanna Osorio, and we hear here being raised the issues of these tensions and stresses in this new environment. Tell us a little about your experiences in relation to this psychosocial dimensions and the issues of inclusiveness.
Muchas gracias a todos por antecederme y bueno,
thank you, all of you. I share most of the opinions I've heard so far. On behalf of the institution I represent, I would like to highlight 3 lessons. One is that communication on emergency situations has to be improved. Some populations we are working for felt abandoned and disregarded and ignored and neglected by the authorities at the beginning of the pandemic. They were thinking that something was going on around them, but they were not sure what it was because information was limited around them. Some of them also even told us that they felt people were getting apart from them. They didn't understand why. So they were facing greater risk due to lack of information. Second lesson is that we need to ensure on reliable data and updated information in our communities. Without this type of information, many of the good intentions may have a negative impact or unwanted impact in many communities. Also, the disaster risk management. We need those data and information as soon as possible. And third, I would like to mention that we need to work hand in hand with the communities and develop along with them a disaster risk management strategies. We have to be conscious that all our decisions have an impact on the rest of the people. If our actions do not have a true inclusive approach, promoting participation of the groups in greater risks, and if we don't strengthen the capacities of all the population and conduct survey processes, then our actions may have a negative impact. Existing gaps can be stressed and vulnerability can be increased, thus generating a greater risk for everyone. So we need an inclusive risk management strategy. Thank you.
Thank you very much, Giovanna. And now we have here from the representative of the youth, Natalia Gomez.
Muchas gracias por la pregunta. Y bueno, quizá primero me gustaría consultar en
Thank you. I would like to ask here in the room how many of you, if you can raise your hands, how many of you represent civil society from the communities? Because the youth, we understand resilience is one of the huge lessons we've learned from the pandemic. The capacity of the communities to organize themselves and give responses at a local level and create these networks in many places in my country. The local governments made food and other resources available to the different communities with the most vulnerable conditions, and the communities themselves developed a support network. And the very same communities started, for example, to create these face masks to use during the pandemic. So it is key to keep strengthening the community capacities, because the communities have a great possibility to help. So the communities need to be represented because they are living forces, because we, the communities, do not only react, but we also act on a preventive way. And my second point on a learn lesson is on financing. It is important not to reduce in our region the budget to manage, prepare, and get ready, because unluckily in this war conflict or crisis conflicts context, resources need to be guided towards the risk prevention, and humanitarian resources need to be well guided. For example, we're having droughts in the region and also the hurricanes season. And also because of socio-political tensions, we may have less resources. So this would imply greater gaps and greater impacts, which are going to mostly affect the most vulnerable communities.
Thank you very much, Natalia. I heard coming from those observations a few things which I think I like to summarize. The first is that disaster events create opportunity for policy change and innovation. And we heard that particularly in relation to the case of education, how they were able to use an event to move forward on something that they were planning. And so that's a great positive, which I think we need to recognize. But behind all of that, it suggests that we are not getting collecting enough information to better understand the profile of the communities that we are serving. And these events only heighten that. And there's a mention of lack of information on the characteristics of the beneficiaries. There was also the issue of inadequate engagement in the understanding and the designing of the new tools, etc. So it would seem to me that if we have not already done so, is that it would be important for real definitive, structured assessments of these lessons learned. I have a sense that they're very intuitive, and the issues surfacing here may allow us to think about how to structure this in a way that we can learn individually at the sector-wise, country-wise, and certain as the region of Latin America and the Caribbean. And this takes me to an issue that surfaced directly and indirectly in relation to the experiences identified. And it's about communication and the interface between scientific and academic knowledge and community knowledge to improve the understanding and the relationships of the hazards in the environment and the socioeconomic systems. So my question to each one of you, and you have 2 minutes to think about it, how can we bridge the communication gap between scientific academic knowledge and community knowledge to improve understanding of the interrelationship of the hazard environment and socioeconomic systems? So let me start from the other side, and I will start with Natalia.
Bueno, muchas gracias por la pregunta. A mí me parece que todas las personas acá reconocemos.
Thank you for the question. I think that all of us here acknowledge that science and technology is an ally for disaster risk reduction, but always respecting the natural and cultural and social environment of each community. We have a great capacity in relation to special issues, academia and science, and all of it can be used in the communities for their benefit. I would like to give an example of the role of the young people to build these links among scientific and community knowledge. There was Resilience Tech, this event organized by the Youth Committee to risk reduction in the Latin America and Caribbean region, which this event has not been the only one, but because there has been many other events conducted like that one. And in the context of that event, we proposed several strategies to approach the problem, consisting on application to conduct anticipatory actions, inputting information regarding climate and meteorological data, and have it accessible to the communities, because even though we may have this sort of information, sometimes the community does not have access to it. Different devices like bracelets or geospatial visuals items to communicate the information to the communities and capture also the information from the communities. All of it can contribute for the youth to work together with the scientific community and the communities themselves to circulate the information. And in terms of recommendation, we consider it very important to use an accessible language, which is also inclusive and diverse, because also we know that the scientific technological base is very important, but the very own community knowledge is a priority. When we go to identify the risks in a territory, priority are the community perspectives.
So, Leandro, I think this is a great opportunity for you to look at the other side of technology and community engagement.
Sí, yo creo que a la pregunta concreta de cómo se puede mejorar el diálogo academia
So there is a question.
y a nivel sociocomunitario, una de las cuestiones fundamentales es entender que el conocimiento científico sí es fundamental, pero las decisiones se toman a nivel político, y se toman a nivel político porque es importante y es el sector que vela por la comunidad, en definitiva, o es de la manera que nosotros hemos...
It is important that in our democratic system, there's a great opportunity to find the way in which academia can link to the communities in a more agile way, and also to share and rewrite those messages for the technological platforms we have today. Let me give you an example. Ceibal, we had all students connected at the beginning of the pandemic. We had that possibility, but we were seeing that there was some 30% of the students who were unable to use the platforms to learn. And that helped us understand why they couldn't use technology to their benefits. So we had to create new channels and media and different type of content to reach those communities. That is what was mentioned here before. We have to understand the end beneficiary in order to develop the necessary strategies. And I want to mention artificial intelligence and everything which has to do with sensors and perception of the human interaction that allow those technologies to be personalized in terms of their response. And regarding data, well, that's a completely different chapter. Thank you, Leandro.
Now I will hear from Claudia.
Desde la región hemos estado implementando la política centroamericana de gestión integral de riesgo, la cual ahora constituye el marco orientador. En esa vinculación,
in the link of this intersector approach, we've found that we have to integrate the gender and inclusion perspective into the academia and also the youth in the development of our information and coordination platform, whose main objective is to identify the vulnerability of the territory and the strategies to reduce disaster impact in the regions. We've engaged in the different with the different groups to go deeper into the development of certain strategies to give a response based on data. And we've also established links with other agencies like the NASA and others. And in the face of this challenge of almost 30 climatological events which have affected the region in the recent years, we've incorporated a group of different actors like the academia and to strengthen the capacities in our countries and to strengthen the link with the communities and the local governments, and trying to promote an identification of the needs with an inclusive approach and methodological guidelines to include the people with disability, the indigenous population, women, with an inclusive perspective, as our core message indicates, which is to have the people at the center.
Questions from the floor, and I would like to use this opportunity to bring them to the panel so we can be responsive at the same time we are engaging. So, Alex, one viewer has asked, what has been the key in Ecuador and the region to carry out inclusive prevention and response actions for people with disabilities and other adults? That's been asked to you. And I certainly think Giovanna will probably have a comment on that question.
Gracias, Jeremy. Esto trae un poco y va directamente relacionado con la pregunta anterior en relación a cómo mejorar la comunicación del riesgo.
This is related with the previous topic, and I would like to highlight the indigenous population situation. In that case, definitely the indigenous knowledge is one, or maybe one of the most important elements for the prevention, preparedness, response, and recovery of disasters. And that was clearly identified and highlighted at the high-level dialogues, along with the Pan American Health Organization and other organizations. The indigenous people identified as a substantial point. But for that, in the health area, other elements are also necessary, which is articulation between primary service attention and hospital service attention, with a respectful approach to diversity and communities, in where indigenous medicine or traditional medicine have to be acknowledged and respected. So, highlighting the need to strengthen the intercultural competency of the knowledge of the actors in order to be able to communicate the messages to the different actors, highlighting the importance of indigenous knowledge. And the other aspect is the Latin American network to manage the disaster risk management in the region.
Thank you. I believe that we need to take into account that all the programs that we will start developing and execute should have universal accessibility as a motto to enable effective participation for the population involved. It is very important to work with populations involved. That's what the Sendai framework says. I believe that we all want to do this. We are all willing to do this. We don't want to leave anyone behind. But when we don't work under the umbrella of universal accessibility, we are leaving many people behind because what we do doesn't reach out to everyone. Thank you.
Yes, you wanted to respond to that quickly?
Si me permite nada más resaltar un punto importante.
Yes, I'd like to highlight something important in connection with what has already been mentioned. Overall, the center of intervention should be the people, communities, and this entails that prioritization, identification of problems, as well as solutions should arise from a community-based, inclusive approach where the elderly, the youth, adults, indigenous communities should be the leaders of actions, not just to prevent, but also for preparing for future emergencies.
Thank you very much. I want to take this opportunity to respond to question number one, which is really going to get us to the core of the conversation about how our existing institutional arrangements are able to adjust to these new challenges or changing environments. So this question is to Claudia. How do you ensure the coordination with all stakeholders within the regional agenda? Could you provide an example of the strategies developed? And we are thinking of this in the context of COVID. Thank you.
Nosotros en la región estamos actualmente
In our region, we are currently promoting the update of the regional humanitarian assistance mechanism that is based on the previous reality whereby the government was the sole responsible for emergency response. Our regional mechanism establishes a link of a humanitarian response to a disaster only among 7 countries. And of course, we know that that's not the right action or strategy for effective response in a timely and effective manner as a mechanism establishes. So we are updating our regional humanitarian assistance mechanism so that it can involve not only the 7 countries, but we are also incorporating the humanitarian players, the private sector, the academia, and all the actors that are involved in an answer, particularly to identify those differentiated needs and the impact of these events in the territory for better coordination purposes. This instrument has also been validated by our heads of state at the 2021 summit meeting, and we are ready to present it after the regional drill, where neighboring countries will be participating, also incorporating the humanitarian players, the civil society, as well as other structures that are directly involved, working for effective cooperation so as to have a better response, particularly with effective coordination, identifying what the situation is like in connection with a disaster and how a response can be provided. I invite you to the regional drill in June of this year in Panama, where we will be working in an articulated fashion. And after that, we will be presenting this to the summit meeting of presidents so that it is a binding document for all countries.
So I just want to probe a little in that area. Am I correct in understanding that the lessons from COVID-19 have required a re-articulation of the governance arrangements for coordination of events? Is that correct?
Sí, posterior al COVID-19 se
Correct.
estableció.
After COVID-19, the contingency plan SICA COVID-19 was established with the perspective of intersectoral integration. One of the lessons learned, not just from COVID, but also from the multi-hazard scenario, proved evident that there was the need to continue working and articulating the different parties at the regional level, that words are translated into actions and that there are instruments in place to make sure that we are fulfilling those policies and strategies with real indicators and particularly with community-based information. And that is why we are setting up this coordination and this approach with civil society organizations with an intersectoral approach as well as multidisciplinary, so that there's regional participation for the Central America integration structure at the national level with the structures that make up the national risk management structures, providing greater participation to local governments as well as the community structures also through civil society.
Thank you very much. This question being directed at Natalia. For the example you provided, who made the first approach to the communities to teach them about resilience? This is a question probably about principle. And who advanced communities' engagements? So there's a big question about process.
Yeah. Bueno, muchas gracias por la pregunta.
Thank you very much for your question. In connection with this, I'd like to mention that in many situations, it's the communities themselves, regardless of whether we are in a committee or in an organized group. We get trained on resiliency, but also on how to address the different threats. How, in a situation of floods, for example.
Entonces,
or if we are in a time of drought, the different groups get organized. Based on my perspective and based on my experience, this arises from the communities themselves, but it is important to have interinstitutional coordination. Institutions have knowledge and expertise and resources, so if there is a link between communities and institutions and the different sectors of community, we make true headway. So in this case, it's communities themselves, and when there are groups and committees and civil society groups, how do we move towards the inclusion of communities among ourselves? Because many times capacity building comes from the different sectors. So my first answer here is that it's between the collective itself and we push each other gradually from that point.
One of the viewers have raised a question that I was also ruminating on in my mind, is that in the conversation so far, we've spoken about agencies, civil societies, etc. where we have never touched the issue of the private sector. What was the role of the private sector? Or based on your experience, how can the private sector be better engaged in this whole idea of dealing with some of these contingency situations? And I will give Leandro the first opportunity to speak to that.
Sumamente interesante pregunta y de hecho
It's an extremely interesting question, and as a matter of fact, there are really very relevant examples in this sense. In concrete terms, for Ceibal, Ceibal has international vendors, the ones that provide platforms. We had the problem that not all students were being able to connect by video conference with their teachers because the connectivity plans were not sufficient for them to cover 1 gigabyte per hour, which is what a video conference requires. So in speaking with the private suppliers, we managed to have a technological agreement where the traffic was released, and Uruguay became the only country in the world where students during the pandemic could have 24 hours connectivity with their teachers, and this continue to be the case today without paying a cent. And this was possible because private players reached an agreement and they made changes to their own technologies, and they worked hand in hand with the public sector. And then as regards information, as you know, Uruguay was one of the countries that closed schools for the shortest period of time. And this is because we had information available
y las
on
autoridades
what was
podían en
happening
tiempo
on
real
the platforms in connection with learning, with the learning process. And authorities, through the Ceibal deployed information systems, they were able to see what students were learning and what they were not learning. And that's why the decision to gradually open schools was made. And Uruguay ended up being one of the countries that closed schools for the shortest period of time because they had real-time information.
About how we engage and how we prepare is seeming to be emerging as a core issue. And maybe I might want to say start at home and ask this question. How many of you as organizations and entities have yourselves started looking at some continuity kind of operations for your own organizations? And so this is not to put you on the spot, but this is to probably respond to another question that is asked there. So I want you to start by self-identifying first, and then we can respond to the others. So have any of us here, just show a hand really, have any of us here on the platform as organizations started thinking based on this experience or before about the whole idea of continuity of operations?
En nuestra región nos hemos visto afectados por
In our region, we have been affected by 958 disasters associated to events with huge losses. This had a huge impact on gross domestic product, and this is why we are promoting effective articulation with the private sector, promoting public and private partnerships, particularly involving them from a prevention perspective. And this is why we have developed methodologies to develop operations continuity plan, business contingency plans with a social approach in order to set up this bond with the government, civil society, and private sector, as well as strategies that will enable us to characterize the risk, promoting more active participation of the private sector that guarantees the minimization of the economic impact, particularly so because we know that there is a cascading effect that affects societies, that leads to displacement, inequality, poverty, and migration. And that is why within the regional mechanism structures that we are currently developing, we are incorporating the private sector as well as a key, strategic player promoting this comprehensive and sustainable development. In the regional drill, we will also have the participation of the private sector, and we are also involved in an acknowledgement process. We want to recognize both humanitarian actors and certification, as well as the private sector in order to set up a closer bond with governments.
Giovanni wants to respond.
Sí, gracias. Me gustaría.
Yes, thank you. I would like to share with you two ongoing initiatives. One, as I said, there wasn't easy of access information. People with hearing inabilities using sign language would go to certain locations, and people were wearing face masks. People who were trying to read lips couldn't receive the information. So for this, there were institutions that got together and they created transparent face masks. But that wasn't the end of it. Several of these institutions were trained on sign language. What for? For them to be able to communicate with sign language users to prevent inaccessibility of communication. My second example has to do with the fact that since the pandemic, psychological first aid started to be provided online. So we cooperated so that this service would also have an accessibility component. Today, psychological first aid continues to be delivered online with accessibility. So we deal with people with disability, elderly, and many others. Thank you.
En Ceibal tenemos un área completa dedicada a continuidad del servicio y se vuelve.
At Ceibal, we have a full area devoted to this, and this is a key aspect, and it is broken down for the different services. Ceibal is a small telecommunications company. It is a content company. It is a company that distributes devices. As an innovation agency with technologies for the educational services, we need to provide continuity in each of these areas. So in connection with learning, we have made progress on universal design for learning, trying to apply all the principles so that even in populations that have been affected by different types of disabilities, they can use the platforms and the devices that we provide. At the technological device level, we try to mitigate the effects of the absence of power, electricity, or lack of connectivity. And finally, as regards software, if a service goes down, which is frequent in risk situations, we explore alternative channels for routing the population to them, taking into account that today in Uruguay, internet connectivity for education is as equal as water and electricity services. If Ceibal goes down in Uruguay, it's like there not being water or electricity from the point of view of learning. So we conceive ourselves with that principle. So that requires a change of mindset that we have embarked upon in order to provide service continuity.
On this one, right?
Por favor.
Okay, bueno, con respecto a la...
Después.
Durante estos 3 días se ha discutido muchísimo.
During these 3 days, a lot of discussion has been going on around the importance of systemic approach, particularly so when we talk about planning for business continuity plan or ongoing operations. So it is critical and paramount for risk assessment not to have a multi-hazard approach, but also to take into account all the elements that revolve around this that have already been highlighted. So it should go hand in hand with prioritizing. These priorities stem from risk prioritization when assessment is performed, particularly for one of the industries which is the health sector, without leaving other sectors aside, of course. If there is one institution or one industry that has continued to operate regardless of circumstances, it's been hospitals. And of course, that doesn't mean that the staff that had to stop surgeries or consultations stayed comfortably at home. They struggled to provide response for COVID. So we need to continue working on this, not only health, but also the economy, the social sector, among others.
Sí, para finalizar, sumado a
Well, to conclude and to follow up on what my colleagues have already said, I'd also like to point out a process that I have been working on closely. We have a committee in Costa Rica, and this committee and this social structure has members from the private sector, from community aqueducts ministry, from members from the Ministry of the Agriculture, Youth and Civil Society members. And we work on this social fabric, which is not something that happens overnight. It takes years. So we have worked constantly to strengthen the social fabric. Like in the case of Hurricane Otto, it happened that during this event, one of the community aqueducts was emptied. The community had no water. This social fabric is strong and active, so in a proactive manner, and another community aqueduct helped the other community. And this is because the social fabric was strong. And this is why local governance is so important and should be prioritized. This will help us address emergencies working in a proactive and preventive manner.
Thank you very much. There's a question there directed to me, so I don't want to exclude it since the Caribbean voice is not here. And it is to Mr. Jeremy, so I think there's only one person who calls me that. How the Caribbean islands dealing with the cascading effects of the pandemic and the war in the Ukraine. And I would like to say here that there was an early engagement between academia and the disaster risk management community early from the outset, in which they provided that scenario foresighting that really scared the government's interaction, the thinking that they have to do something very critical, especially given the nature of the economy. And since that, based on the characteristics of the regional organizations, they were given leave if the health sector providing the epidemiology, forecasting, the military services providing the logistics, and collective buy-in and common information sharing. I say that very quickly because I know we don't have much time. So I want to give you all 30 seconds to say what would be one priority you would recommend for advancing community, reducing community vulnerability or improving resilience in support of systemic thinking. Starting from here. 1.
Investing in technology for communications.
Okay. Claudia?
El involucramiento de las comunidades.
The involvement of communities, the engagement of communities. Resilience should be community-based, and this is where we should focus all our efforts so that it is communities having the knowledge on their exposure and risks and strategies to be able to better respond to disaster situations and empowering them at all levels. The integration of youth in the different spaces in a cross-cutting manner, not just as participating actors receiving information, but also as solution providers. 5 concrete elements to improve inclusion, making people visible to know what they need, who they are, for them to participate in all the phases of inclusive disaster management risk reduction, to improve access and accessibility, not just to health services, but also to communication and information, to improve capacities at all levels in order to clearly understand what their priorities is taking inclusion into account and response capacities that meet the priorities that were mentioned earlier. To review the risks present in our communities for all the people making up the community, taking into account the broad human diversity, therefore the different specific needs. For example, a sidewalk that's broken is not a problem for many people, but it is a big risk for others.
Thank you very much. And I want to thank the panel for this very engaging experience. I hope you enjoyed here and online. And there are some questions we're not able to get to. But I want to summarize what the takeaways from here as I see it. The first thing is that we want to see the opportunities that's created by the pandemic in particular about getting us to revisit the current assumptions and approaches to our planning and operations from the hazard by hazard approach, recognizing that we are living in a very dynamic space. It says also that this requires some basic principles of agility, flexibility, and inclusivity, and that these have not always been evident based on the experiences identified. The understanding and profiling of our services or people in the context of our hazards seems to be a critical platform for moving us in that direction and should require urgent investment, building on the technology and inclusive knowledge, etc. I think we recognize the engagement of the academic sector, and I think I heard a call for them to be more inclusive and engaging in the products of their work. And therefore, we want to see what the RSI recommends or commits to supporting this process in their declaration this afternoon. And finally, this idea of, I'm not sure if I said it before, but I want to reinforce it, that the question of governance is going to be the key. It's going to call for a revisit of the current arrangements for managing not DRR, but development. Thank you very much for listening to the opportunity to share.
Muy bien, de esta manera damos por finalizada la sesión plenaria riesgos.
So we hereby conclude the parallel session, Systemic Risk, Inequality and Inclusion, Lessons from the Pandemic for Disaster Risk Reduction. We would like to thank Jeremy for his moderation and as well as the panel members. So we continue with the 8th platform. Besides the presentation on Ignite stage, there are 2 more events. One is on fire risk management, another one is on media, and a learning lab on the initiative developing resilient cities. And some messages you can answer by email or the QR code that you will see on screen to fill in the poll on this last day of the 8th platform for disaster risk reduction for Latin America and the Caribbean. And let me remind you that the vaccination area is still open. At the observatory of Regional Platform 23, people are still working on taking into account the gender perspective. We will make a break and we will reconvene in a while for the last activities of this 8th platform for Latin America and the Caribbean for disaster risk reduction.